smart dentures. Okay, let's talk about smart dentures. So we say that the integration of smart technology into dentures is an emerging area of research. Okay, it may not be popular now, many people may not have heard about it, but this research is going on trying to integrate smart technologies into denture productions. Now, these smart dentures, they will be designed to provide real-time monitoring and feedback on various aspects of your oral health. So imagine you as a dental technologist producing a denture, and you have smart technologies integrated into it that the patient no longer needs to return to you in order to report a problem or the other. What happens? You will be the one to recall the patient and say, Mrs. A or Mr. B, you need to return back to the clinic. There are certain things we need to check with your mouth because we are receiving real-time reports of your oral health status. You might think that this is not possible, but today the cars that we drive have the kind of technologies that is incorporated into them, that the manufacturers have put it in the car, that the car will even tell you, the driver, when to take the car for servicing. Okay, so you're driving a car. If your car is low on oil, you don't need to manually check your oil. The car tells you that the oil is low, that you should go and top it up. So these are technologies we are bringing into denture fabrication, that when you grow with the trend and be the first to learn these things and begin to incorporate smart technologies into your denture, you can have a database of the dentures you have produced, the smart dentures you have produced, and you can monitor the progress of your patients in real time. Dental practices can use that to monitor the oral health of the patients. They can monitor the functionality of the crown of the dentures that you have produced. So if there is, let's assume that the denture you have produced, the teeth is cracking, but the patient doesn't even know. You get the report that maybe one unit of the denture is beginning to fail. You invite the patient and say, we have seen from our system that one unit of your denture is failing. Please, could you come back to the clinic for a repair? Okay, so instead of sitting back and fighting these technologies, let us be the first cohort to embrace the technology and integrate it into our practice. For example, sensors can be embedded in the denture and they can track biting and chewing forces, providing valuable data for assessment to assess the efficiency of the denture and dictate any potential issues. Okay, I noticed that Macy and Nelson, you still have your hands up. Could you lower your hands so that we can actually know when someone wants to make a new contribution? Additionally, smart dentures can monitor oral hygiene practices, reminding users to brush and floss regularly. Okay, now there are some Oral-B electric toothbrushes that can actually monitor the pressure that you are using to brush your teeth. So it tells you when to increase your brushing pressure or lower your brushing pressure. It monitors the time you have spent. Okay, these things are things that we actually never thought could be possible, but now these technologies are there, and this is very, very possible. It's even exciting for me to think about it, that we could achieve that level of integration of smart devices, smart monitoring devices into the dentures that we are producing. Okay, now, is there any person that thinks there could be ethical aspects to consider in these issues, ethical dilemma? Do we think that there are some ethical dilemma that may arise from these issues, especially the integration of smart technology to monitor real-time functionality of a person's denture? Do you foresee any ethical issues with that? Yeah? So, yes, there are ethical dilemmas that will be associated with issues like this. Okay, Obinna, do you want to quickly make a contribution? So these are ethical dilemmas that we need to be aware of, and then be sure that we are actually being ethical in the use of digital dentures. For instance, would you really want someone to know how many times you chew your food before you swallow it? Would you want someone to know that much details about you? Because these dentures may have the capacity to actually calculate the frequency of your mastication. So do you want someone to know that much about you, monitoring the frequency of your mastication, monitoring the force of your biting? Okay, so there are some ethical aspects. What about the issue of consent? Okay, someone would have to give informed consent before this data can be collected. Okay, so you wouldn't want anything to you wouldn't, as a practitioner, you wouldn't want to get into any ethical dilemmas and ethical issues with the use of this technology. And this technology should also be, we should be able to have it in such a way that someone can opt in and out of the monitoring. Do you understand? So it can be something that it should be something that could be switched off or switched on, so that a person can choose not to let you monitor their data, or can choose to let you monitor their data at will. Okay? So we should be aware of these things as potential ethical dilemmas. The other one feature of digital denture production is enhanced comfort and enhanced fitness. Okay, the fitting and the comfort that we can achieve with digitally produced denture. So we say that denture technology is focused on improving the comfort and the fit of dentures to enhance the wearer's experience. So like one of you did say, or I'm not sure who said that when you produce your denture, you are more concerned about the comfort of the patient. You even pray and hope that the denture doesn't break. You want that patient to have a better experience, a longer lasting experience. And if you relate this back to the conversation we had, the longer and the better the experience of your patients, the more referrals you will get. So if you make a denture that is going to last perfectly in good shape and in good aesthetics and in functionality for a longer period, you are more likely to have those patients carrying testimony about your work, referring people back to you. So it could be a win for you. Now, you don't want to be that practitioner that you make a denture and every 6 months your patient is having to come back to you to do some repair work on the denture. You can demarket yourself by that kind of practice. Okay, so we need to think about the value. Is it value for money for the patient? How comfortable are we making the patient? So we need to think about enhanced comfort and enhanced fitting. But these things can be controlled using digital denture production. So we say that advancement in materials and design techniques aim to create dentures that closely mimic the natural oral structure and provide a comfortable and secure fit. Okay? So this is something that I have said. So we can get to a point where we produce dentures that will begin to mimic the natural appearance of the supporting oral structures, that the dentures might even be able to move with the movement of the oral structure. So if the person is gaining weight and the gum margins are expanding, the denture might be able to expand with it and still give precise fitting, okay, and still give enhanced fitting for that same patient. So we say that innovations such as softer and more flexible dentures, denture-based materials, and adjustable denture clamps, and improved denture adhesives contribute to better retention and stability, reducing issues such as sore spots and discomfort in the patient mouth. Okay, if you consider the dentures that we are producing now, look at the fitting, the base that fits to the gum. Consider that and compare it with dentures that were produced many years ago. Most of these dentures produced decades ago have very rigid base that fits on the teeth. Some of them can traumatize the wearer of the denture. Okay, now we are moving away from that traumatic experience of denture wearing to now a more comfortable experience for the patient, where our patients will use their denture and have zero discomfort. Okay, and the denture will also have a long durability. The other thing is aesthetic enhancement in the when we use the other thing we achieve when we use digital, when we go into digital denture production, is enhanced aesthetics. So the aesthetic aspect of denture continues to be an important focus when people go for to get a denture. Okay, before, people were more concerned. Remember when we looked at the history of denture production, people were more concerned about filling the space and functionality. But now people are as aesthetically aware as they are in terms of functionality. So people no longer want a denture that will be there, fill the gap, and help you to chew and help you to prevent people from knowing there is a gap in your mouth. People now want something that can actually give them a brighter look, a more aesthetic appearance. So enhancement in materials such as highly lifelike and natural looking dentures, denture teeth made from ceramics and composite resins, enable dentures to closely resemble natural teeth in terms of color, the shape, and the translucency. Okay, so we can now produce dentures that can actually resemble, take a very close appearance with the teeth that you have there. If you check in the past, there are dentures that you will see when they sit in the mouth of the patient, it is very obvious that from here to here is different from here to here, especially if you are putting anterior dentures. Okay, so people are now very concerned about aesthetics, and we as dental technologists should be able to produce dentures that can seamlessly integrate into the oral cavity, that someone will not be able to differentiate between the oral tissues and the artificial prosthetic that is in the mouth of the patient. And there are technologies that are available now that you can integrate in your denture fabrication that can give you this level of aesthetic appearance. That the color of the teeth of the denture will be exactly the same and mimic the color of the teeth in the mouth. Have you seen what were the chameleons before? Do you know about chameleons? Yes? What is it that makes chameleons to become very important and unique animals? Because they can mimic the color of their environment. Okay? Those technologies, well, it's not inside, it's natural to the chameleon, but the technologies have been produced to make certain objects mimic the color of the environment. There are cars that can change color now. Okay, there are cars that can change color, that can mimic the color of the environment. So such technologies can be incorporated into our denture fabrication, that the moment you insert the denture in the mouth, it mimics the color of the rest of the teeth, and it will seamlessly integrate to the oral cavity, that nobody will know that this person is actually wearing a denture. So these are the level that we should be thinking about in our dental production. Then the other one is the Hollowness resolution, or Hollowness solutions rather. Okay, so the Hollowness is an innovative approach that combines the benefits of denture implants and the dentures. This treatment involves the strategic placement of a few denture implants to support the full arc of a prosthetic teeth. Okay, so you have a full arc of a prosthetic teeth for an edentulous patient, and then that you use a few implants to integrate them into the oral cavity, and they are fixed in such a way that if you are not told, you will never know that this is a prosthetic teeth. It's not the original or natural teeth. Okay, and the achievement of this is very, very possible using digital denture production. So the Hollowness solution provides improved stability, functionality, and aesthetic compared to the traditional removable dentures. Okay, and they offer a fixed option that eliminates the need for denture adhesives and allow for more natural chewing and speech capabilities. Okay, so this is very popular amongst people that do not want to deal with removing the teeth and putting it back, that do not want to go through the embarrassment of ever having their denture to flip out of their mouth, people that do not want to risk losing the denture. Okay, so when aesthetics is your concern, when functionality is your concern, when durability is your concern, then people go for these Hollowness solutions. So these are technologies that we need to learn and incorporate into our denture production. We can also have our personalized denture design, which is the future of denture that lies in the personalized design approaches. We are talking about patient-centered production. Okay, it's not, of course, generally the production of denture has always been patient-centered, because it's not one cap that fits all. But we can enhance that level of durability, that level of personalization, to a point where it becomes seamless. In this case, advanced digital imaging, the scanning, and the modeling techniques will allow for precise measurement and mapping of the oral structures. So this will be more advanced than what you would have done manually, because we can do both the measurement, the mapping of the oral structure. You don't need to produce the denture first and then you go and fit it into the mouth to see whether it fits or not, and then you go back to begin to realign them in the manual denture production. When you go into personalized denture production using the digital systems, and you combine all of these technologies that we have, both the 3D, the digital imaging system that we have talked about, the scanning, and the modeling using the CAD/CAM system, the production. You can measure, you can smile, design the denture, and do all of those things in such a way that once it is produced, it fits and integrates into the oral cavity seamlessly without need for readjustment and realignment. So this information is then used to create customized dentures that fit the individual's unique anatomy and aesthetically preferences. So the person can be able to express their aesthetic preferences, and then you can use that to actually integrate into the patient's workflow. So personalized denture designs can ensure optimal fitting, comfort, and functionality, resulting in a more satisfying experience for denture wearers. Okay, so it's all about the patient and the satisfying their experience. So, are you happy to take 2 minutes break, stretch your legs?